National Suicide Prevention Month is a time dedicated to raising awareness about recognizing warning signs of suicide and providing the key support that saves lives. So joining us in studio to talk more about some of the community services that are available is Andrea Cook, the Development Director over at Macon's Mental Health Matters. Thanks so much for joining us in the studio today.
Thank you for having me.
Of course, talk a little bit, one of the core missions of Macon Mental Health Matters is kind of breaking down the stereotypes and making sure that services are available. Talk a little bit more about that with us.
This project was started in 2021, wow, to provide barrier-free, no-cost access to people, more specifically people of color or underserved communities who have long had stigma. There's been a stigma associated with accessing mental health care. And so we remove all barriers for people to access care.
Yeah, definitely. In the most recent years, breaking that stigma has definitely been a big priority for many people because you're right, in especially the African American community, there is a big stigma there when it comes to receiving mental health treatment and services and care. What do you see as one of the biggest challenges facing the community when it comes to discussing the topic of suicide?
I do believe that people often think if you bring up the topic of suicide that you're encouraging people to engage in that action, and people who die by suicide give so many signals. They are looking and seeking for people to see who they are and see what they're going through and welcome the opportunity to talk about what they're going through. So just making sure that the community knows, like anything to do with mental health, people want to talk about it, but more specifically when it comes to the phenomenon of dying by suicide, the people who are struggling really want to be directly asked about it.
Yeah. Now, sometimes this is a really tough topic for many people, and when thoughts are shared about thoughts of dying by suicide, people don't know how to respond or what to say. So what advice would you give to people when it comes to responding to someone bringing up thoughts like that?
I think, even myself, practice asking the question, getting comfortable with talking about what it means to for somebody to make the decision to die by suicide. How research the numbers, find out in your community who is most affected by this this issue. And once you get more comfortable with the idea of talking about it while you're practicing, then you'll be more comfortable talking about it with others. I can assure you that people who are experiencing these thoughts of dying want to have an opportunity to talk to somebody. Many of the people who have attempted have stated that if one person had just asked them how they were feeling, then they probably would have prevented them from attempting.
Yeah, talk to us a little bit about the demographic of people who are doing this. Is it still a certain age range? Often we talk about this with our teens. Who is this heavily affecting, or is it kind of everyone?
There's no socioeconomic determination. There's no age discrimination. It's the social construct of race. It's any and everybody can be affected by the sadness associated with somebody who no longer wants to be here. And so there are teens and young people are more apt to speak about it openly, but there are people that range from 5 and 6 years old to 99 who consider dying by suicide. More specifically, in Macon County, we've sadly lost 11 people this year to death by suicide, and so just it could be anybody. It could be your neighbor. It could be your child. It could be a parent. So anyhow.
Yeah. I hate to hear that number about the 11 people. Obviously, we're only in September, so that's more than one person, practically each month. So really sad there. When we are having these conversations and you guys are doing the work that you do, how are you guys directly kind of combating that stigma and just working to continue to just raise awareness and have this open dialogue with people, or even youth in particular?
part of what we do at Macon Mental Health Matters is, regardless of who we encounter and where, we're asking people how they feel, and then we want people to use emotions words. When you can identify the emotion that you're feeling, you can do something about it. And we practice asking that question, and we have posters and brochures available for people to, if they're not ready to have a discussion about it, they have access to the information. And just telling people, if you're struggling and you can't get to us, there are plenty of agencies in our community that are helping to combat the drought of mental health professionals. But also you can call 988 and get some assistance.
Yeah. Is there anything else in this month of prevention that you would hope that people take away, or any last words that you just kind of would hope that they hear?
I hope that people will reach out if one of the activities that we're hosting isn't available, or if they feel the need to just need help finding a therapist, to reach out to us, or to just reach out to some family member, or make a point to ask your sibling or your child or your parent or your teacher, your coworker, how they're feeling, and then really listening to their response.
Yeah. Well, thank you so much for joining us in the studio today. Make sure you stay with us in our 8 o'clock hour. We are going to continue to discuss the supportive role that the community plays in suicide prevention throughout Macon, and of course with Macon Mental Health Matters. If you or someone you know is experiencing depression or showing signs related to suicide, you're asked to call 988. That is a 24-hour suicide and crisis lifeline. September is Suicide Prevention Month, but for Macon Mental Health Matters, maintaining good mental health is a year-round focus. So joining us to continue our conversation right now is Andrea Cook, the program's development director. Talk to us a little bit about, some of the ways that Macon Mental Health Matters kind of brings some of these resources out into the community.
Oh man, we work really hard at making sure that mental health is accessible. When we started our work, Georgia was 51st in access to mental health care. And for the #1 state in the country for business, we can do something about that number. So specifically in Macon, I firmly believe that Macon is the most mentally healthy city in Georgia. There's a concerted effort to address the mental health disparity here. But we offer no-cost mental health services, so that's therapy, adjuncts to therapy. So we offer knitting and counseling, cooking and counseling. We have a whole mental health week. It started out as one day where we were offering a mental health pop-up, and now we stretched that out to a full week. But as difficult as the work is, it's important to make sure that our community specifically knows that we are working hard to ensure that people get good access to care.
Yeah, talk a little bit more about some of the agencies that you guys work with, or even just some of the programs that you guys bring to specifically help these people.
Every second Friday of the month, we have a Mental Health Alliance meeting. So any agency like River Edge, who has a vast amount of services, so they offer mental health care, but they also offer some supportive care. Because sometimes you can't take care of your mental health if you don't have housing, And then Family Counseling Center offers an array of services that are either at no cost or on a sliding fee scale, and many other counseling agencies in our area. Pace Center for Girls. A lot of the sororities and fraternities offer some assistance, and so there is so much help. I mean, we partner with the library to offer a knitting club, and so there's a therapist who sits there while you're learning how to knit. I mean, there are just so many opportunities for people to access care, and I hope that they will reach out and seek it.
Yeah, obviously throughout this entire morning you've been talking about a lot of free programs and ways that people can get involved, but how do people find these schedules, or where do they go to find this information?
Okay, so Macon Mental Health Matters is funded by Macon-Bibb County. As always, we thank the mayor and the commission for funding this project. And so they heavily share our information. This past week we had 2 events. So it was an Active Dads partnership with Macon Violence Prevention, where there was Ice Cream with Dads this past weekend, and then Monday was the men's mental health meetup, and there was a record number of men that attended that session that have been talking about the fact that they've been looking for some additional support. But they can go to MaconMentalHealthMatters.com. They can go to Facebook and find Macon Mental Health Matters, Instagram and LinkedIn. So we do our best to try and share the activities, and thanks to Macon-Bibb County, all of the activities that we offer at no cost.
Yeah, in that you just mentioned the men's mental health meetup, but do you want to talk a little bit more about that and what those are, because I know that they happen quite frequently.
So every fourth Monday, Macon Mental Health Matters, Macon Violence Prevention, and Serenity Entertainment Complex partner to offer. It's supposed to be an hour, but it usually turns to about 2.5 hours for men to have a safe space. And they have specifically asked that women not be present. So occasionally they invite me to come and tell them about our services, and as soon as I do that, I am out. But we also have a women's mental health meetup in response to that men's mental health meetup that we partner with Ashley Nicole and Chic Culture downtown to provide a safe space for women to also share and non-judgmentally. So we have so many opportunities, and there's safe spaces. And if there's anybody who can think of an activity that we're not offering, reach out. I'm happy to partner to create whatever the community feels is missing.
Yeah, and before we let you go, obviously in this month of prevention, talk to us about ways that we can help our neighbor when it comes to them thinking about thoughts of death by suicide, or even if they are suffering from depression or things like that.
I think the first thing that each of us can do is check in with ourselves. Like I said, get more comfortable with the topic, because if you're uncomfortable, they're going to be uncomfortable. Learn those emotions words so that you can check in with yourself, see how you're feeling, because you're more apt to truly understand. But when you ask somebody how they're feeling or how they're doing, take the time to really listen and respond, and don't respond simply because to fill up space. So genuinely care about your neighbor and care about yourself. That is the advice that I would share with anybody.
Yeah, too often we speak to one another and ask, how are you doing, just to have small talk, but not often are we actually listening, engaging, taking the time to hear what they're saying. So thank you for that tidbit, and thank you so much for coming in and sharing all the information that you did today. Of course, we want to let you know how you can keep up with all of these upcoming meetings and the services that are made available to you. Take a look at that website on your screen, MaconMentalHealthMatters.com. Just visit that website to get all the details on these events we've been talking about today, or to find these resources. If you or someone you know is experiencing depression or showing signs related to suicide, call 988. That's the 24-hour suicide and crisis lifeline.